The president of Harvard is fond of saying that the university is there to help make a difference in the world. We also believe that being global means being local in as many different places as we can be. So we have about 22 different international locations where we are involved in a close way on the ground, and in Tanzania is one of those locations.
Tanzania is an East African country with a population of about 56 million people. Just like many sub-Saharan African countries, Tanzania faces major public health issues. At the height of the HIV/AIDS pandemic, in Dar es Salaam, for example, a major economic city in Tanzania, the government, through the local authorities, Muhimbili University, and Harvard came together to lead the administration of interventions against HIV/AIDS.
Dar es Salaam system enjoyed the support of MUHAS and Harvard in innovating on how to introduce ARV services in Tanzania, because this was the first time. It needed a lot of training of people who were providing services, nurses, doctors, clinicians, everybody, data experts. But at the same time, it needed rapid research activities to try to innovate some of the approaches that were used elsewhere to see whether they can be applied here, but also to be able to see whether it needed to adjust in how we provide the service or the policies. That was the idea. So it was thought that we needed a different institution that would focus on that. And that's where AAPH came up.
Welcome to the Africa Academy for Public Health.
Africa Academy for Public Health, AAPH, is a Tanzanian non-government, non-profit research organization established in the year 2009 with a focus in advancing public health priorities in sub-Saharan Africa through collaboration with different partners including Harvard University.
The collaboration between Harvard institutions, higher institutions of learning in Tanzania as well, began in the early 90s. About 25 years ago, it was the beginning of this kind of collaboration which we are enjoying today. It started slowly, but little did we know that it was going to be of this magnitude and size it is today.
The Africa Academy for Public Health, which was established 10 years ago, is one dimension of Harvard's international engagement.
The mission of the Africa Academy for Public Health is to advance public health priorities through implementation science research, training, capacity building, and knowledge translation.
We have been fortunate to collaborate with Tanzanian institutions for the past 30 years or longer than that. We have been able to develop strong partnerships with leading institutions, Muhimbili University, University of Dodoma, Ifakara Health Institute, and with the key stakeholders at the Ministry of Health, at the regional health management teams in Dar es Salaam and Morogoro.
The Africa Academy for Public Health demonstrates the effectiveness of developing local partnerships. We know that should something change, there will still be a cadre of people on the ground who can continue to do important work that needs to be done. It's not that hard in many cases to come up with a list of things that need to be done. But it's usually pretty hard to actually do them, and to do them well is even harder. And that's where I think the Africa Academy for Public Health has really succeeded.
Capacity building happens within ARISE and within our partnership in Tanzania across a number of levels. One is faculty development.
So we have successfully expanded our undergraduate training opportunities as well as our postgraduate training opportunities, but we still seem to have a stumbling block in looking at the PhD and postdoctoral training, where there seems to be less opportunity for this than in other institutions or other sciences or fields in the health science of Tanzania. We have a long-standing partnership with Harvard. What are our goals? Long-term goals is to foster sustainable research capacity through degree training at Harvard School of Public Health. We have had the opportunity, a number of our staff at MUHAS, and not only MUHAS, but also other universities and other institutions, research institutions, have had the opportunity to do master's and doctoral degree programs at Harvard, and also postdoctoral training. Short courses have been run at Harvard as well as in Dar es Salaam. And we have a South-to-South laboratory training program that occurred in collaboration between us and Botswana, which was also affiliated to Harvard.
There are major human resources challenges in Tanzania and in other parts of Africa. So one key effort really is for AAPH, in partnership with Harvard and Muhimbili and other leading institutions, to build the capacity of the next generation of leaders in public health. There is a second element around training of mid-career professionals, people who are active in public service at ministries of health or at non-governmental organizations. And so that happens through short courses that AAPH organizes and puts together. And the third element of capacity building that AAPH has been active around is internships for college students, undergraduates, and recently graduated, those who are seeking an exposure to public health.
We assist interns to identify areas of interest that they would like to pursue and have more knowledge on the ground, assist them to ensure that they're also mentored, and we usually ensure that they're mentored locally, paired with another mentor, usually from Harvard University, just to get that opportunity within this platform that provides that rich environment where different studies can be implemented, different avenues for discussions of research findings. They really are able to get robust knowledge.
My passion is really to see healthcare in another level. So here at AAPH, I get to learn how to do research, I get to go in the field, I get to see firsthand how to report on different aspects of healthcare and ultimately improve it in a manner of changing policy and also translating knowledge to the community. Outside the Africa Academy for Public Health headquarters, trainees are sent into the field, at times to supervise research assistants. It is important for Africa Academy for Public Health to have an eye on the field activities to ensure quality and accuracy in the data collected. I'm happy and proud to say that Africa Academy for Public Health has equipped me to become a field researcher in the public health and elsewhere that I might go.
Research, technology, and data systems. The backbone of research is data. AAPH does collect several different types of data.
Launching into the research field is the most exciting. As the teams venture into the unknown, they ensure that the equipment is safe. In some areas where Africa Academy for Public Health collects data, the infrastructure is not friendly. So research teams have to embark on the journey by foot. Africa Academy for Public Health is dedicated to excellence and integrity in data collection. Upon arrival, researchers set up camp to prepare for data collection. Despite the hardships of the journeys into the field, Africa Academy for Public Health ensures that the true sampled population is reached and surveyed. Teamwork is the secret behind the success of Africa Academy for Public Health.
A lot of the research that AAPH is leading is in response to the ambitious agenda that the government of Tanzania has set for the health and well-being of people in the country.
Key stakeholders who have the main mandate for ensuring health, good social services, safety and everything is usually governments. And we ensure that everything we do, we try as much as possible to engage and ensure that the government is informed. They are part and parcel of the planning.
I'm aware that the African Academy of Public Health convenes various stakeholders interested in public health research and health systems training, focusing on maternal, newborn and child health, infectious diseases, cancer, cardiovascular disease, nutrition, mental health, HIV and tuberculosis. Sincerely, it is your involvement in these areas that contribute to informing policy and contribute to our achievement in the health sector. We need also to make decisions also having been supported by scientific research and data. So I look forward to working with the Africa Academy of Public Health and the Harvard School of Public Health to at least to get
scientific information and data on number of challenges which we are facing in Tanzania.
Caught me off guard. Asante sana, Dr. Mary. All right, no music, no smoke, no fanfare. Very professionally done, asante sana. And we're going to hand over the booklets to everyone. Yes, that's correct. Excellent. Well done. Yes.
Without further ado, ladies and gentlemen, I would like to echo and again thank very much our Honorable Minister Umi Mwalimu for accepting our invitation to come and launch the strategic plan.
What's going on now is exactly what we had anticipated, and slowly to spread countrywide and go even beyond Tanzania.
It gives me great pleasure to welcome you all to this morning's symposium. We're looking at girls and women's health in sustainable development. We have been holding this series of annual symposiums that usually happen around this time. In 2005, we held our first symposium, and it focused on agriculture, nutrition, and health. It was great to bring together experts in the different areas where in the normal sense, ideally everybody focuses directly in their areas of expertise. So it was good to really bring together all the experts in the room, because ultimately the goal for agriculture, for nutrition and health is really to improve the health of the population. So it was a great discussion. In 2016 January, we had a discussion, and the theme for that symposium was adolescent health. Last year, January, we had our symposium that was focused on community-based health program, where we had our ministry share advances in the progress towards building our own community health program, CADR, and officially launching it in the country. So that was great progress to learn.
Africa Academy for Public Health plays a significant leadership role in enabling the ARISE network to be founded in the first place, as well as to continue to progress and bear fruits for this partnership across the region.
The Africa Research, Implementation Science and Education Network, also known as the ARISE Network, was founded for collaborative education and research activities across African countries. The network comprises of scientists and teams from the countries of Botswana, Ethiopia, Ghana, Nigeria, South Africa, Tanzania, and Uganda.
The ARISE network focuses on two main streams of work. Much like AAPH, much like Harvard, the focus of ARISE is on research, more translational research, translating findings that we know work to address major public health challenges in Tanzania and other parts of the African region, and disseminating and scaling up those interventions, coming up with lessons learned that might be useful for further expansion of these services.
In the January 2020 Tropical Medicine and International Health European Journal, the ARISE Network published a special issue on adolescent health in sub-Saharan Africa. In this special issue, the ARISE Network aimed at covering the knowledge gap among adolescent information, in lower and middle income countries in the areas of nutrition, sexual and reproductive health, mental and physical health, health service utilization, and substance abuse.
It has taken time for people to understand that there is an institution here that is focused on training and research, but now it's getting to be known. And there is a very clear evidence that many other institutions now have started using it to do research, and then definitely if there is need to do training, it will also have to do training.
AAPH today has been quite successful in advancing its vision and mission that it has articulated for itself right from the beginning, and that is really to approach public health as an opportunity to advance the health and well-being of individuals in Tanzania and beyond.
This is a platform for Harvard researchers in public health and related fields to carry out work, to engage in training, to recruit students to the school, and help to build capacity and develop research collaborations in Tanzania and beyond Tanzania.
It is our hope that the community around us will be excited as we are to work with the Africa Academy for Public Health. It is our hope that when people see the Africa Academy for Public Health, they see excellence. It is our hope that when you see AAPH, you see integrity. We also do hope that when you see AAPH, you see it's an opportunity for fostering partnerships and collaborations. Welcome to the Africa Academy for Public Health.